Hello, my name is Phelan Bailey. Today I'm going to be discussing pediatric obesity and what we as healthcare providers can do to address this epidemic. The rates for pediatric obesity have continued to rise over the last 30 years, which the rate for 6 to 11-year-olds tripling and the rate for 12 to 19-year-olds doubling over that time frame. With obesity in young age comes a lot of risk factors to older age, including diabetes, hypertension, and dyslipidemia, can also affect their psychosocial development as well, leading to low self-esteem and a lot of anxiety issues. Currently, the Institute of Medicine recommend that healthcare providers should track BMIs and offer counseling to patients and families. But with the limited contact that you have with your patients, that might not be enough. Looked at several studies. They were all randomized control studies, which offer a good quality of evidence and a moderate level of certainty. All of these took place in the school setting, and they were all structured nutrition and physical education teaching. Looked at the benefits of that versus no intervention at all. The findings, study 1 found that there were decreases in BMI, increase in daily physical activity, and decrease in daily TV viewing. Second study found decrease in BMI and better academic performance in obese children. And third study didn't find a difference in BMI, but it did find a decreased daily soda intake, decreased weekly fast food intake, decreased total calorie intake at the end of the intervention. Nursing implications for these studies findings. Currently, providers have limited contact with the children. Increased contact may be beneficial. It also shows that in-school intervention has been proven effective. The school setting is where kids are used to learning, so it would make sense to teach where they know that they learn. Along with the BMI changes, several other benefits that go hand in hand. You see an improved diet, decreased screen time, as well as increased physical activity. The proposed intervention is a community nurse, which would do teaching in the school setting. The teaching would be performed one-on-one in weekly sessions with obese students. That way you can train their knowledge over a time span. Focus on the American Academy of Pediatrics recommendations, the 5-2-1-0 every day, which is at least 5 servings a day of fruits and vegetables, no more than 2 hours of screen time a day, at least 1 hour of activity a day, and 0 sugary drinks per day. Using these guidelines that have already been shown to work takes a lot of the work out of creating a curriculum whenever it's already there available. And early intervention, getting to these kids as early as possible can decrease the occurrence of the chronic illnesses and improve their quality of life overall. So in summary, pediatric obesity does continue to be a major problem that we really need to try hard to fix. Addressing it early can decrease the risk for these chronic diseases and improve the quality of life for children into adulthood. Evidence shows that structured educational sessions related to nutrition and physical activity do work. There have been studies that have shown that they can decrease their BMI of obese children over time. The ideal intervention would be one-on-one sessions with the community nurse and the child in the school setting. So it's very conducive to learning if they're already there and ready to learn. And the one-on-one would allow the nurse and the student to work through issues, questions, any kind of concern that they have, so it can be more tailored to their knowledge level and their needs. Thank you.